My project was exploring the effects of a novel walking aid skills app in walking aid users through a pilot randomized controlled trial. Walking aids, such as crutches and canes, can contribute to secondary injuries if they are improperly fitted or used. Mobile health apps are often used in healthcare settings, but no standard app exists to teach safe walking aid use. The ICanWALK app was developed to teach these safe walking aid skills. These are some selected screenshots of the app where participants are able to choose a module based on the skill that they want to learn with their specific walking aid. They watch a video of a model performing the skill and then record a video of themselves performing the skill to compare to. And then they answer component questions with yes, partial, or not yet, leading to a final summary score which will help guide their future education and learning of that walking aid skill. The objectives of the study were to evaluate the ICanWALK app on the following compared to an attentional control app: the effects on balance, confidence, pain, and falls, effects on comfort, knowledge, and confidence in performing walking aid skills, and to determine the usability of the ICanWALK app. Participants were included if they were between 6 to 99 years old, used a walking aid regularly, or expected to use one for 7 or more consecutive days. They were then randomly assigned to the intervention group or the control group. At time point 1, they completed the activity-specific balance confidence scale to assess their activities of daily living, the Numeric Pain Rating Scale for pain, falls, confidence, knowledge, and comfort with walking aid skills. They completed a supervised app module walkthrough with the researcher, and then completed a post-app survey with the system usability scale. At time point 2, they completed a pre-app survey, then they used the app modules independently at home, and then completed a post-app survey. At time point 3, they completed a single survey at home without using the app. The ABC and NPRS scores were analyzed using a mixed effects ANOVA with Bonferroni correction. This is a table showing the participant characteristics. The average age was 45.5 years old. There was an even sex split with 4 males and 4 females. All participants self-identified as white or Caucasian. There was a diverse range of previous walking aid use experience. This is a box plot demonstrating the ABC scores over time for both groups. The intervention group had lower scores than the control group, but only T1 scores significantly differed between the groups. There is no significant between or within group differences in NPRS scores for upper or lower limbs, and there was a decline in system usability scale scores from T1 to T2 in both groups. This is a figure demonstrating the perceived comfort with performing walking aid skills, notably walking aid fitting and assisted gait pattern for the intervention and control groups. For the intervention group, we can see that there was a shift towards increased comfort, whereas the control group was relatively consistent throughout for both of the skills. Regarding knowledge, the intervention group again demonstrated a shift towards increased knowledge, whereas the control group was relatively consistent throughout the study. And then regarding confidence, there was again a shift towards increased confidence in the intervention group, while the control group remained relatively consistent throughout the study. The low baseline ABC scores may be influenced by age, underlying conditions, and experience with walking aid use. Walking aid training alone may not be sufficient to modify perceptions of pain, which is complex and multifactorial. The shift towards increased comfort, knowledge, and confidence with walking aid skills in the intervention group suggests that the app may be beneficial for improving those domains. Finally, a socially desirable response at T1 and no researcher assistance at T2 may explain the decline in system usability scale scores. To conclude, the ICanWALK app may improve comfort, knowledge, and confidence with walking aid skills. However, the small sample size limits the generalizability of the results, but it provides a foundation to conduct a larger scale RCT. Future research should seek a more diverse participant pool with different comfort levels with technology. Thank you. And these are my references and my acknowledgements.